tātou, Tala Palaba. It's a pleasure to be here. It's been a long day. I told everyone just now that the brain's full. Some wonderful conversations today, fantastic presentations. Reflecting on public health is not exactly the kind of thing you want to do at the end of a long day, so bear with me. I think the measles, recent measles outbreak, the measles outbreak, and of course the current issue with coronavirus, I think is a good time to reflect. And my presentation really is about, we're in this together. New Zealand, traditionally, the approach to managing public health threats, particularly from the Pacific, is to be quite restrictive at the border and try to keep things out and so on. But you will have seen that or will have heard, the measles outbreak, particularly in Samoa, had its origins in New Zealand, as I understand it. Obviously, there were the environment in Samoa, and there were lots of reasons for it. But I think the fuel that lit the big bonfire originated in New Zealand. Time will tell, and I no doubt investigations will confirm or not. But the point is that the traditional approaches we've had to managing public health threats in this region perhaps no longer suitable. You see, there's a lot more interaction now between New Zealand and the Pacific than there used to be. In the old days, of course, it was one-way traffic south to the land of milk and honey. As Pacific families accumulate a bit of wealth, there is, in fact, quite a bit more of flux to and fro. People have a house in Auckland, perhaps, and one in Samoa or Cooks, and a lot more movement. And of course, air travel being more affordable, I am certain that these interactions will escalate. So that's a little background. One of the things I like about the work we've done in the region is that the leaders have come together and said this region could be a good example for the rest of the world, and they crafted this vision for the Pacific back in 1995, which they renewed in 2015. Basically talks about how and what they see the region, focus on children, focus on environment with older people. And of course, in more recent times, particularly as a result of the UN conference, SDGs, increasingly and rightly focus on the ocean, health of the ocean. And this is not my picture, but this is a picture of what that vision could be. Healthy, vibrant, educated young people celebrating their cultures. Today, though, I just want to cover three areas. One is some selected indicators which are important, particularly because I don't think it's widely known. Talk a little about essential public health services and my assessment of public health functions in the region at the present time. And more importantly, how and what New Zealand Inc., when I say Inc., I mean everybody, governments, academic institutions, individuals, NGOs. I'm really wanting to encourage this idea of much greater collaborative interactions. And one of the things I want to point out is that actually the Pacific has got a lot to offer New Zealand, and I'll talk a little bit about the Pacific Ncd Roadmap and the MANA dashboard that we're using to monitor progress on NCDs. I have a few slides, so I'm going to go. This is an old slide from WHO, basically to show that the Pacific here in the Western Pacific region is very similar to the Americas and the European region, where 75–80% of the deaths are due to non-communicable diseases, heart disease, diabetes, cancers, and so on. The bit that perhaps is not as well known, the next few slides will be on the situation in the Pacific. The good news is in the last 20 years, There's been commendable decline in infant mortality. This is the example of Fiji, and under 5 mortality. I'm confident that these trends are real because it was produced by SBC. They don't necessarily go together, but they did try to verify the trends from a number of sources. So fantastic improvements in infant and under 5 mortality, probably mostly attributable to improvements in living conditions, socio-economic conditions. The bad news is life expectancy, on the other hand, has plateaued, both men and women. The Fijians are denying this, of course. They say it's not correct. And in the case of Papua New Guinea, where infectious diseases continue to predominate, we see the same thing, a decline in infant and under 5 mortality and a leveling off of life expectancy. The worst example is probably Nauru, where for men it's leveling off in the mid-50s, and for women around 60. We think with some confidence that this is NCD related. Work to verify that, but that's, and this is a trend that, as I say, perhaps is not as widely known. I want now to turn to the work that the region is doing in responding to non-communicable diseases. In 2013, the Ministers of Finance asked for a report on NCDs. You see, the Ministers of Health in the region have been working away on this for some extended period, with a disappointing impact, I might add. In 2013, the Ministers of Finance asked for a report which basically showed what you know, and as a result of that, SBC, the organization I worked for, WHO, the World Bank, Australia and New Zealand, produced this document called which led to the development of the Pacific Roadmap for NCDs. Sorry, I'll just go back. And essentially, the Pacific Ncd Roadmap is the predominant policy piece that is being used around the region to prevent and control NCDs. I should point out that there are a lot of things that happen in New Zealand that inspire many of the island nations. One of them is tobacco-free Pacific. It's modeled, it's trying to emulate the smoke-free 2025 in New Zealand. The unfortunate thing is, even though the ministers adopted this back in 2013, there hasn't been a clear and mapped out pathway to give effect to the idea that the Pacific could be smoke-free. But nonetheless, I think it's a good development. It gives people the idea or the possibility that the Pacific could be a tobacco-free sub-region. So the NCD was jointly developed. There are 5 key elements. The key one is tobacco taxes. These are all evidence-based interventions, a small selection from the WHO list of cost-effective interventions, tobacco taxes, alcohol tax, food and drink products, improving the efficiency and impact of the existing health dollar, and improving the evidence base for interventions. In other words, a manageable list of interventions alongside some of these other. And of course, as a result of that, in late 2019, 16 of the 21 Pacific Island nations have increased taxes on tobacco. They tell me that cigarettes cost, the highest cost for tobacco is in the Cook Islands. So pretty impressive progress, if you ask me. 12 nations have implemented tax on soft drinks. New Zealand is still deciding whether it's coming or going, as I understand it, even though the evidence is pretty robust. So the Pacific is leading the way on this particular note. Increased taxes on alcohol, 14 of them, and 2 nations have reduced taxes on fresh fruit and vegetables. Let me turn now to what's called the Pacific Monitoring for NCD Action Framework. This is essentially the monitoring tool that the island nations use to monitor, measure, and report on whether or not they're making progress. So it's got 3 domains, one on governance, one on policies, one on health systems, and the other is on monitoring trends. And it's based on a traffic light system, red for not a lot or nothing at all, green for policies or strategies are in place for preventing and controlling NCDs, and the stars give it a strength of action, if you like. Here's an example of a result from the MANA dashboard. In this case, it's on tobacco, the various interventions down the side here, and this is all the nations in the region. And as you can see, the block red at the bottom here stands out, which is really around the fact that the tobacco industry is doing a good job interfering around the region. And no surprise here, of course, because the tobacco industry is facing some resistance in Australia and New Zealand, and they regard the Pacific as a soft touch. The legislative policy framework is not particularly robust. But what this tells us, that collectively they could focus on work to try to moderate or mediate, reduce the impact of the tobacco industry. If you take alcohol, similar thing. Green for most of the activities. Alcohol taxation, drink driving, licensing across all the nations, but alcohol advertising and sponsorship remains a big gap, if you like. And I think it's helpful in the sense that this will give the nations what they need to focus on. Some progress. You celebrate your small gains in this game, as you know. NCDs is a hard one to tackle. In this case, tobacco use, daily tobacco use. In Samoa, we know with some confidence that between 2004 to 2011, there's been a decline. Similarly, in Kiribati, Solomons, we think, is an artifact of reporting, better reporting, and hopefully it's not a real increase. Tonga, we thought, had made progress on reducing tobacco use, but apparently not. This one slide I have is about climate change. It's obviously the big issue of the region at the present time. And this one picture, I stole it from somewhere, is a picture of the maternity ward in Tarawa in Kiribati, showing, as you can see, fairly dramatic wave action outside the maternity unit. And so the issues I've just explained to you just now is based in the context of the nation very concerned about the impact of climate change. And in fact, climate change, the focus on climate change may have pushed the issue of NCDs to the background. The other example I want to share with you is one on water. This here is access to clean water and sanitation. You see, beyond the picture postcards that you see from the Pacific from your family and friends on holiday, access to water remains problematic. And on this slide, you see, compared to the rest of the world where access to clean water is improving, access to clean water in the Pacific is possibly going backwards. And in Papua New Guinea, it could be as low as 1 in 5, 1 in 6 without access to clean water, and similarly sanitation. So, you know, the point of showing you this slide is we still have these very basic public health challenges, and perhaps people are being distracted by other priorities and pressures. So let me just turn now to public health. For many of you, of course, it's a familiar story. These are what I regard as core public health services: needs assessment, developing responses to those, and assuring the audience that we're doing what we should be doing. So these are the 10, this is based on the CDC list. There are other lists around on what essential public health services are. And this is my assessment. Monitoring health status, I gave it one smile. It's there, but it's reactive and ad hoc. Some would say had there been effective needs assessment and monitoring, we would have picked up earlier on the threat of measles around the region. So it's there, but it could be better. Diagnose and investigate hazards. I couldn't quite decide, so I gave it a question mark. Again, it's reactive, and again, it's ad hoc. There's a lot of emphasis on campaigns, community campaigns, what I would regard as education, individual education. A lot of focus on the T-shirt and the pamphlets and the brochures. Nothing wrong with them, but it's not enough. As you know, you need more than education. You need supportive policies. You need all of those elements of the Ottawa Charter if you are to have an effective campaign. One thing they do well is mobilize community partnerships for whatever public health challenge there is. And, oh, that should be weak, sorry. So on the policy and regulation side, not particularly strong, and I gave you the example of tobacco. Linking people to personal health services, generally they do well. For the last 3, particularly around the workforce, there isn't a structured program for training of the public health workforce. It tends to be reactive, responding to scholarship opportunities from Australia and New Zealand, and most definitely there is no structured and ongoing professional development opportunities for the workforce. And this might be something that academic institutions or individuals in New Zealand might think about if you think that you may have something to offer. A lot of work being done and people are stretched, but they're not, those interventions are not always evaluated, and the impact is unknown. The same with research and innovation. One of the real problems in the region is underinvestment in health. So this is, actually this is the Cook Islands. Fiji, Samoa, PNG, and the Marshall Islands. As you can see, except the RMI, investment in health is pretty low. New Zealand hovers around 10 or 11% of GDP. And as you know, they say that if you are investing less than 5% of GDP on health, it's difficult to see how you can deliver the basic health needs that the communities need. So there's clearly an issue in the region. And so what do I think we should think about, and what should we consider? The key point here is what I mentioned before. It's probably time to think about how we might plan and respond to public health threats together. There is an existing heads of health, ministers of health meeting that occur on a regular basis. New Zealand opts in and out. Sometimes they attend, sometimes they don't. I do think this is a fantastic policy opportunity to address the shared threats that we have. And I would certainly encourage the New Zealand ministers and senior officials from the Ministry of Health to participate more and fully on an ongoing basis in the discussions that takes place on the annual Heads of Health and the 2-yearly Ministers of Health meeting. And I gave you the example of measles being something that might be a good trigger for us to pause and reflect on how we might go forwards together. I think there's a real need to perhaps put together a regional pool of experts, and I don't mean just Pacific people, I mean those who have knowledge and experience in the Pacific to be deployed and across the region in order to respond to the threats as they exist. I think it took us a while to mount a response to support Samoa, for example, on measles. There's a very real opportunity to invest in the public health workforce in the region, and perhaps a structured opportunity for professional development of the public health workforce in the region. And one of the ideas I've been suggesting to people is this idea of a partnership for health across the region, where interested institutions in New Zealand can offer support and training, professional development, and so on for their colleagues in the region. That's in a summary, fairly quick presentation of the issues to do with public health in the region. I'm happy to respond to any questions or discussions. Thank you very much.